The next task we'll be looking at now, the next scenario, is vaginal candidiasis. Vaginal candidiasis. In this particular case, the 30-year-old lady was coming in with an embarrassing problem. Doctor, I've got an embarrassing problem. Again, what do we say? There is nothing to be embarrassed about. We are medical professionals. We do see different patients with different problems. We are used to this, and we see many, many patients with different problems. You do not have to feel embarrassed about anything. You can add confidentiality as discussed, and on top of that, whatever we're discussing here is kept confidential or will be kept confidential. This particular patient has had white vaginal discharge for the past 2 weeks. Sometimes there is itching, sometimes there is no itching. This is where the approach I'm saying. Only white discharge, no any other symptoms, no smelling, no soreness, not very typical. Neither for candidiasis, no for bacterial vaginosis. This is where we would need what? An investigation, a high vaginal swab. Okay, then we can treat. If it's a classical vaginal discharge with the itching and the soreness, that white discharge, that is typical of vaginal candidiasis. Yeah, cheese-like discharge. So you have to make a decision. There are two scenarios. There's one atypical, they expect you to investigate. And there is a typical one, they don't expect to run investigation to treat it straight away. And if it doesn't resolve, then we think of investigation. This particular patient is worried it could be cervical cancer. Her last menstrual period was 3 weeks ago. Approach to the task, our history would be the same like we discussed for any vaginal discharge. Examinations, there is a clear white discharge on the gloves. Again, you may find the same thing in bacterial vaginosis. There's no itching. If there is itching, it is a candida. If there's no itching in here, then it's a typical presentation. We need to do what? We need to investigate. PV examination, observations, abdominal examinations are needed. Diagnosis is a possible candidiasis, but you do not have typical symptoms. If there's no typical symptoms, or you have got typical symptoms of candidiasis, it's a white discharge and it is itchy. So what we can do, we will treat you straight away. Okay, we're going to treat straight away. Yeah, what can you offer? The main treatment is the fluconazole tablets. That's your first line. Fluconazole tablet. Yeah, oral tablet, single fluconazole. Give advice. Use emollients. Avoid contact with potential irritants like soaps that may cause irritation, shampoos or bubble bath. You need to avoid this one. Also avoid the vaginal douching. So the general advice almost similar to bacterial vaginosis. Safety netting. If the symptoms don't resolve within 14 days, you come back. It's one tablet. Within 14 days, the symptoms should resolve. If it doesn't resolve, you come back. In that situation, we will investigate. But if from the beginning it's not a typical symptoms, okay, you can run investigations. You can take high vaginal swab. You can start treatment and take a high vaginal swab straight away. And if it doesn't resolve, of course, you will need to investigate. So look at the scenario there up. So if we have a typical scenario, we're going to give you treatment for fluconazole. We're going to safety netting, 14 days not resolving, you come back. Give the general advice, use emollients, avoid things that may irritate, such as soaps, shampoos, or bubble bath, avoid vaginal douching. Offer a leaflet about bacterial vaginosis, about vaginal candidiasis. If it's atypical symptoms, part of your management would be to investigate, okay, would be to run investigations now to take a high vaginal swab, because there are several things that can cause a white discharge only with no any other symptoms, including normal physiological discharge. Now you have to choose, are we investigate, and then after investigation, we'll start you on treatment, or we can say, it looks like a candidiasis, but because we don't have the other typical symptoms, we can start the treatment, but I also want to take a discharge. If it shows something different, then we can switch the treatment, because it's only one single tablet. Okay. If the patient can take single tablets or does not prefer that or is contraindicated, then you can give vaginal pessaries. Again, it's single, 150 milligram vaginal pessaries. Hope that is clear. You can take swab and give treatment for vaginal candidiasis. because it's a typical presentation. If it's typical, do not investigate. Thank you.